The Department of Public Health says they are one step closer to finding another location for an isolation room for tuberculosis patients. For now, some patients are being treated outdoors in a makeshift holding area, but the agency assures that there is no public health risk or any spread of the disease. We first learned about the makeshift tuberculosis isolation room through concerned residents, so we visited the area and indeed found that some TB patients were receiving treatment in this area, which is directly next to a mechanical room just outside of the Department of Public Health and Social Services building in Manila. It's out in the open, and the only thing covering it is a tent to protect from the sun. But Acting Public Health Director Leo Casil assures us that while this method is inconvenient, it is not a danger to the public.
With TB cases, if it's outside in the air, it's not to where people can get contaminated. It's actually even safer outside because once the air hits it, it just dissipates into the atmosphere. So really, there should be no concern about that. And that's why we have it out there like that for now.
The reason it was relocated to a makeshift outdoor area, explains Casil, is because a TB isolation room is down for renovations.
We're trying to renovate the isolation room, and it's been there for a while. And one of our fans went out of commission. So because of that, we had to find a temporary holding place. And that's why we had it out there.
Casil says they've already identified a new location up at their community health center in Dededo. We visited the potential isolation room along with some public health staff who were assessing the area to submit the specs and details to GURA in an effort to get federal grant funding. Program coordinator Abraham Mora says the room in Dededo is currently being used for storage, but if approved, it will be turned into an isolation room. One of the changes that needs to be made is to place an exhaust in the room that meets the minimum standards for ventilation. Poor ventilation, says Casil, was the problem they were having with the old isolation room at their Manila location.
It's what they call, I believe, a negative
Pressure.
Yeah, pressure. So because inside it sucks out all of the, and it goes into the atmosphere. See, so once it goes out, it just whatever virus or what on TB, it's gone.
I see.
But since it's not working, and then we looked at it, so it's time to renovate and repair this.
Acting TB manager Estelle Addis says that the isolation room went down last week, and depending on how fast the grant funding can be approved and procurement contract could be generated, they are hoping to move patients back into a proper isolation room. For now, she says referrals will be taken at their temporary holding location. She says they are also conducting directly observed therapy, which means TB patients are treated at home to minimize the risk of the spread of the disease. Again, public health assures that there is no public health risk at this time, but they are hoping to expedite the process of getting a new isolation room.